Hey Refam, my name's Kate and welcome back to Keeping It Real, the podcast that loves a little squeeze. We get so many questions about compression garments, so today we're doing a quick little podcast episode just to cover the FAQs. We chat about whether it's okay to take off your compression garment just after surgery in those early weeks, why surgeons have such differing opinions about their efficacy, and whether you can keep your post-op garments on for too long after surgery. As always, let us know if there's any other questions in the comments and enjoy. Today, we're going to talk about compression garments, which is a surprisingly, I wanted to say virulent topic, but I don't think that's the word I want. Yeah, is a topic that I think people do seem to be quite concerned about, especially they want to make sure they've invested a lot of time, money, and everything into this and whatever they can do to control those results. I think is probably why it does feature so heavily. What exactly are compression garments?
I actually quite like to call them post-operative garments rather than compression garments, because sometimes patients will actually freak out if they feel like they're not tight enough. So the compression garments are a fine term to use, but if we think they're more of post-operative garments, so for the surgeries that we do, generally a post-operative bra, which does up at the front, and some of them have hooks on the shoulder straps, which are adjustable as well, a corset or a binder for the abdomen. And for abdominal surgery, there is a corset type garment, which does up at the sides or the front, and some of them have a strap that goes between the legs, and some are just a big elastic with Velcro. For thigh surgery, we generally use types of leggings, and then for surgery, brachioplasty surgery, usually just like elastic sleeves. And then for when I used to do facelift surgery, I used a chin strap.
No, I've stopped. Well, I'm doing slightly different techniques. I'm doing quilting sutures, so it all is sutured down, so no need for garments.
How long do you suggest that patients wear post-op garments after surgery?
So there's no scientific time frame for when we would do that. I often will recommend wearing it for up to 6 weeks, but sometimes if a patient's at 3 weeks and the garment is bugging them, then generally you can come out of it. It's more often driven by patients to stay in it. So if a cohort of patients who become, for want of a better term, addicted to their garment, and they, even at 6 weeks, I still feel comfortable wearing it. I want to keep wearing it. And obviously it does no harm, so there's no problem with keeping on wearing it. But I'd say 2 or 3 weeks is the minimum. 6 weeks is about the usual. But yeah, I've had patients wearing it still for several months after the surgery. And even like in a modified way, so they might say wear it during the day, not wear it at night, wear it for activities, or wear it at night, not during the day, just mix it up a bit.
And it tends to be, I think, for the abdominal surgery patients that they tend to like to wear it for longer, whereas the breast reduction patients, they tend to get out of it a bit sooner.
Wait, which ones get out of it sooner?
The breast and the tummy, they stay because they like the support. Yeah, they feel like if they take their abdominoplasty garment off, sometimes they describe it like they feel like they're going to fall apart.
Yeah, right.
We've only had 2 patients fall apart.
I was like, I had none.
Yeah. A little bit of guts. Okay, just to clarify, no one has come apart.
Yeah, I think that makes a lot of sense and the compression bra would just feel quite similar, like to a sports bra, right?
I think with the bra, it's more, as Kim was saying at the start, it's a post-operative bra. So it's just a bra without an underwire. And some patients like wearing a soft crop top from Kmart or Target, which is also fine. It's mainly to not have the underwire sitting directly on the scar. That's the theoretical reason for doing it. The other reason from our point of view is that it's a bra that does up at the front. So when we come and see you the next morning, we can easily undo it without making you sit forward and undoing it and lifting it up.
Yeah, I think, but like from a psychological point of view, I definitely get the difference of that, where it's like a bra is just normal, and maybe especially if they're having like a breast reduction or something, that's not a positive affiliation, whereas like the tummy tuck, I think I can see how that's something new and different and completely out of it. And it's like, okay, this equals good result.
I've had some patients that are stressing that like if the bra doesn't fit perfectly, that their result is going to be compromised, which like our surgery really is what's giving you probably 99% of the result. The shape of the bra, whether it's too tight, too loose, etc. Like there's internal stitches. All the work that we do in theatre is really what's creating the shape. And also I've had patients that have said before their surgery, oh, my boobs are terrible because my mum never got me a right shaped bra or anything when I was young, and I never wore it at night time, and so I've got these saggy boobs. And probably urban myth with all of that as well.
Yeah, that's so funny.
But the sleeping on your chest when you're young, that is true, that it makes your breast bigger.
Bigger.
Smaller.
And doing all those chest exercises and all those things.
It is funny that it's like, all those things just get purported, but you would maybe, if you never interrogated it later, if you were just like, oh yeah, no, that's a fact.
Yeah.
And just,
I've got these terrible boobs because my mum, it was fault. And it's like, well,
I think
maybe.
one of my biggest is a patient comes in at whatever, about a month after any surgery and says, can I sleep on my side now? It's awkward because I've never once told a patient not to sleep on their side for any surgery that I can think of. But it's obviously urban myth that gets perpetuated and I don't know, maybe from the hospitals tell them. And I don't know, they come back from surgery, they're lying on their back, they think that's where they're – and so you just have to politely say, yeah, sure, from today, today's the day. You can start
anytime you like.
sleeping on your side. So just for anyone watching who's having surgery, had surgery, I can't think of a single surgery where you can't sleep on your side. Tummy tuck sleeping on your front would be hard just because I suppose you could do it if you, bit of a visual image here, but it had a couple of pillows under your tummy and recreated that beach chair position, but upside down. But if someone really wanted to sleep on their tummy, you could do that. But sleeping on your side, you can just be in the fetal position and get the same effect as if you're lying on your back.
I guess just facelift you'd want to, but it would just be too painful, wouldn't it?
Like sometimes it's just discomfort that limits people. Like because the surgery goes around the side, so it's a bit uncomfortable to lie on it. But patients lie on their back when they've had a lower body lift and a bra line lift, so it's possible.
What are the purported benefits of compression garments?
You're the world expert on this.
Well, there's a whole list of things that are theoretical. Again, most of them are not really been scientifically proven. I think certainly in the first few days, pain reduction is something by having something external that's supportive. It means that the areas move around a little bit less. The bra in particular is quite good to be able to put ice in it, ice packs in the sides of it. There's other theories, decreased seroma formation, probably not scientifically proven either. Decreased bleeding and swelling. I think swelling is probably something like, but you'd have to have the perfect millimeters of mercury of pressure, which we don't even know what that would be, to be either not too tight, not too loose to help with the swelling. So I think a lot of their benefits are anecdotal, and if it feels comfortable and it feels good, then it's probably doing the right thing.
How tight should it feel?
You should be able to
just
breathe.
Snug. I think snug would be the medical term that we want.
I saw a thing that was saying like stage 1 and stage 2 compression garments. Yeah. So like tighter. We don't do that, do we?
Well, I think that would be initially in the first 72 hours after surgery going to be more swollen. So maybe there'd be some case to be made for having a slightly tighter garment after that period of time. All the garments we use, there's actually usually more than one tightness that you can have it on. So there's usually 2 rows of eyelets that you could do it, or in the Velcro one, you can just make it looser or tighter.
Those compression gratings are, they definitely have those type of things for leggings. So after varicose vein type of surgery, then they have different grades of heaviness and tightness of the tights that people get put into. And they're all very measured, and there's like whole different charts, but yeah, there's definitely not that range of possibility for what we do. Because I actually, when I did my Facebook Live, I spoke to the companies that provide us with the garments, and I'm like, hey guys, can you send me through some science and evidence that you have that these are good? And they're like, well, there's not heaps. Yeah. So it was actually really interesting reading. And lymphedema is another one where really good evidence that compression garments help decrease pain and swelling.
How come you guys use them if you're not 100% sold?
Oh, no, I think they definitely provide some support and comfort to patients. But yeah, when, as Kim was saying before, I don't think we're not relying on that. Yeah, I think patients, definitely more comfortable for patients and they feel supported. I think the only garment, if you like, that I think I sometimes use actually to help with the result would be a breast binder where you put it, so when you're doing a breast implant and it's sitting high and you want to try and push it down, you can use a binder that sits at the top of the breast and helps to push the implant down. I've considered maybe doing that primarily for all patients, so not worry so much about the bra, but just use an upper breast binder to try and push it down, because I think the main thing that we see with breast implants is that Frankenboob appearance where the breast implant is sitting high early. But yeah, definitely patients feel more comfortable. I just know that because patients sometimes want to keep wearing it for months and months after.
Yeah.
And even I've had people come in for a different, say they've had a breast reduction and then they've come in 2 years later to talk about other body parts and they're like, oh, I still wear that post-op bra. I love it. Like, and they're not wearing it as a post-op bra by then. They're just wearing it as it's a nice, soft, comfortable bra. So,
but early days, I used to just use a tubie grip for a tummy tuck and even a tubie grip for breast
surgery
implants.
as well.
Yeah. So tubie grip is the elastic stocking, so they come in different sizes.
Oh, okay.
That's like the simplest thing, but I moved away from it just because it's too difficult to examine the patient the next day. So you
like
sort of roll it up.
Giant.
Yeah, sock.
Yeah.
Correct.
And they don't.
And then,
look
they
back
fray
great
at
and
the
they
ends.
fray.
We can't have our patients walking around hospitals looking like that.
Patients might come in and be very concerned about, and even when I sit at the desk, get a lot of calls about if they have to take the compression garment off for an hour or like for the shower, or they left home and they forgot it and they're freaking
whole
out.
result will be ruined.
Yeah. Is there any impact to having any kind of time in those like early post-op times?
No, they might just feel a bit scared and unsupported, but we wouldn't say it's fine to take it off if we were worried about things falling apart. I think you had a patient a few years back that showered in it.
No, I commonly recommend,
day.
especially with the tummy ones, because there's quite a thin material. It's absolutely fine to have a shower in it and dab it dry with a towel. You'll be cold and wet for an hour or so. But and I'm being serious.
You are.
But I'm always serious. I'm not doing it because I don't want them to take the garment off. It's just maybe early days. It's not easy getting in and out of the garment. So if you wanted to just have a shower with the garment on, like that's absolutely fine.
If you're choosing between the two.
Yeah, I don't think it makes any difference, and it'll dry pretty quickly, and obviously no problem getting the wound wet, and kill two birds with one stone. You don't have to then wash it. So the other scenario where patients get a little bit anxious is the garment's a bit soiled, got a bit of blood on it, and they want to wash it. And can they take it off? Absolutely. You can take it off, wash it, dry it. If you're out of it for an hour or two, it's not going to make any difference whatsoever. But the way to circumvent that, shower with it on.
Yeah.
And you could soap it up as well. So you could soap up, like if there was an area that was dirty, you could soap that up, rinse it off, get out of the shower, wrap yourself in a towel, you'll be fine.
Why do you think surgeons have such differing opinions on the efficacy of compression garments?
I think two reasons. Whenever there's no evidence around something, there's always a plethora of recommendations. So there's a whole lot of areas in, especially what we do, where it's not really evidence-based, and everyone's got their own dogma and they say, this is the right way and this is how I do it and this is how you've got to do it and there's no other way, you can't do it any other way. And then the other thing is a bit of a marketing game where people are trying to claim that sort of one up everyone else and provide what they're saying is better service and things like that. And so that leads to a wide disparity of opinion. But as Kim has looked recently into the evidence, none of it is evidence-based. You could just as easily go to 2XU and get a tight-fitting legging or upper body garment and it would be probably just as effective, harder to put on and off. That's why we don't use that.
And doesn't target the areas that we're typically doing as well.
Correct.
Over-the-counter shapewear undies, I often tell people to get into those from that 4-6 weeks onwards so they can wear like normal things under their clothing and if they want that extra bit of support and for exercise. So,
is there ever a time where compression garments are a bad idea?
Ooh, well,
I think if they're extremely uncomfortable and too tight, then definitely could cause some blood supply compromise to the skin. So if something feels so tight that either you can't move, you're struggling to breathe.
Breathing's good.
Breathing's really important.
You heard it here first.
Yeah, because if you're taking small, short, little breaths, then there's risk of getting chest infection and all those kind of things. So yeah, if something's like really digging into a wound or digging into an area and is uncomfortable and you can't actually move because of that, then yeah, for sure it would be that's incorrectly sized.
The main area often is with the garment corset for the tummy tuck, because people come in all different shapes and sizes, but the garments don't necessarily match that. In patients who are maybe a little bit shorter, the upper part is digging into the ribs and it can become a bit too tight. I've had one patient who actually got a bit of a pressure sore, I think, from the garment being too tight there. But you can sometimes just undo the upper couple of eyelets and release that.
If you liked that episode, there's plenty more where that came from. Maybe start with some of these or head to our channel for your peek into the mysterious world of plastic surgery.